Hello and welcome. Today we're diving into conjunctival squamous cell carcinoma, or CSCC. This is a type of cancer that affects the conjunctiva, the clear membrane that covers the white part of your eye and the inside of your eyelids. While relatively rare, understanding CSCC is crucial for early detection and effective treatment. So, what causes CSCC? The primary culprit is exposure to ultraviolet or UV radiation from the sun. Just like with skin cancer, prolonged and unprotected sun exposure significantly increases your risk. Other contributing factors include human papillomavirus, or HPV, infection, especially types 16 and 18, which are also linked to cervical cancer. Additionally, individuals with weakened immune systems, such as those with HIV or those taking immunosuppressant medications, are more susceptible. Pre-existing conditions like ocular surface squamous neoplasia, or OSSN, can also progress into invasive CSCC. To understand CSCC, we need to talk about pathophysiology. It begins with damage to the DNA of conjunctival cells due to UV radiation or viral infection. This damage can lead to uncontrolled cell growth and the formation of abnormal, precancerous cells. Over time, these cells can accumulate, forming a tumor. If left untreated, the tumor can invade surrounding tissues, including the cornea, the orbit, and even spread to nearby lymph nodes, leading to more serious complications. Epidemiologically, CSCC is relatively uncommon, but its prevalence varies depending on geographical location and population characteristics. It's more frequently diagnosed in regions with high levels of sun exposure, such as tropical and subtropical areas. It typically affects older adults, with the average age at diagnosis being around 60 to 70 years. Men are also more likely to develop CSCC than women. Certain ethnicities, particularly those with lighter skin tones, may also be at higher risk. Recognizing the signs and symptoms of CSCC is key for early detection. Common symptoms include a raised, fleshy growth or a thickened, white patch on the conjunctiva. This growth may be accompanied by redness, irritation, or a feeling of a foreign body in the eye. Some people may experience changes in vision, such as blurred vision or distortion. In more advanced cases, the tumor can cause pain, bleeding, or even eyelid deformities. It's crucial to consult an eye doctor if you notice any unusual changes or growths on your conjunctiva. Diagnosing CSCC typically involves a comprehensive eye examination by an ophthalmologist. This includes a slit lamp examination, which allows the doctor to closely examine the conjunctiva, cornea, and other structures of the eye. If a suspicious lesion is identified, a biopsy is performed to obtain a sample of tissue for microscopic analysis. This analysis helps to confirm the diagnosis of CSCC and determine the grade and stage of the cancer. Imaging studies, such as CT scans or MRIs, may also be used to assess the extent of the tumor and check for any spread to surrounding tissues. While CSCC doesn't have strict classifications into types, like some other cancers, it's important to understand its spectrum. It ranges from mild dysplasia, which is a pre-cancerous condition, to invasive carcinoma, which has the potential to spread. It can also be described based on its growth pattern, such as papillomatous, gelatinous, or ulcerated. Pathologists will often provide a grade to the tumor, indicating how aggressive the cancer cells appear under a microscope. The treatment of CSCC depends on the size, location, and stage of the tumor. Common treatment options include surgical excision, where the tumor is surgically removed along with a margin of healthy tissue. Cryotherapy, which involves freezing the tumor, is another effective option, especially for smaller lesions. Topical chemotherapy such as mitomycin C or 5, fluorouracil eye drops, can be used to treat superficial tumors. In some cases, radiation therapy may be necessary to target residual cancer cells or to treat more advanced tumors. For extensive or metastatic disease, systemic chemotherapy or targeted therapies may be considered. Close follow-up is crucial to monitor for recurrence. Preventing CSCC primarily involves protecting your eyes from excessive sun exposure. Wear sunglasses that block 100% of UVA and whenever you're outdoor rays, even on cloudy days. Consider wearing a wide-brimmed hat to provide additional protection for your face and eyes. If you have a weakened immune system, talk to your doctor about strategies to minimize your risk. Regular eye exams are also important for early detection of any suspicious lesions. The prognosis for CSCC is generally good, especially when detected and treated early. Surgical excision or other local treatments can often achieve complete remission. However, recurrence is possible, so regular follow-up appointments are essential. In rare cases, CSCC can spread to nearby lymph nodes or other parts of the body, which can worsen the prognosis. Recent research is focusing on developing new and more effective treatments for CSCC, including targeted therapies that specifically target cancer cells. Scientists are also exploring the role of immunotherapy in treating advanced CSCC. Continued research holds promise for improving outcomes for people with this condition.